to our frequently asked questions. Today I'm answering a commonly asked question: how long will my lower blepharoplasty surgery take? And in answering this question, well, there is an average amount of time, and generally lower blepharoplasty takes an hour to an hour and a half in order to complete. But we'll also talk about additional factors that may influence the surgery time. What exactly the procedure involves, what additional procedures may also be added to your lower blepharoplasty in order to enhance the result and give you a better result. We'll talk about factors such as revision surgery and your general health, which may influence the time of the surgery. And we'll also talk about how important is the length of time in considering lower blepharoplasty. My name is Dr. Julian De Silva, and I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty is one of the most common procedures that I complete for patients every single day. And the information that we're discussing today about the length of surgery is information that I discuss with my patients every day when giving them advice. So, in terms of lower blepharoplasty, how long does the surgery take? Well, on average, lower blepharoplasty takes an hour to an hour and a half. However, like many things in life, it really is a question in terms of what is required with the blepharoplasty and the amount of detail that is required in terms of completing the surgery. Common changes in the lower blepharoplasty are swellings that are caused by fat, orbital fat, that comes forward in the lower eyelid and is seen as a swelling in the lower eyelid. But there can also be additional changes such as loose skin, dark circles. There can be changes around the eyelids in terms of the quality of the skin. And so these things are also of importance in terms of giving you the best possible result. So in terms of how long the surgery takes, well, it is influenced by the length of the surgery. And so common things that may be completed in addition to lower blepharoplasty to enhance your result include the use of fat transfer, and this requires taking a small amount of volume of fat from around the tummy, and this fat is used in order to soften the depressions and dark circles around the lower eyelids. Sometimes the skin requires tightening, and often a laser can be used in order to complete this. Well, these variations on lower blepharoplasty mean that the surgery may take more like 2 to 2.5 hours depending on exactly what is required. Quite commonly, I complete lower blepharoplasty with upper blepharoplasty in order to give a patient the best possible rejuvenation. And this surgery would take generally 2 to 2.5 hours in order to complete. Other factors that can influence the length of surgery are revision surgery, and having had previous surgery in the lower eyelids does mean that there is some natural scarring that is present, and it does mean that there's some change in the natural anatomy, and this can require additional time in order to give you the best possible results from lower blepharoplasty. Other factors that can influence surgery are your general health, and if you have medical factors such as raised blood pressure, well, it's very important that this is controlled before surgery in order to ensure that the surgical time is reduced as far as possible, as factors such as bleeding and raised blood pressure will generally lengthen the time of surgery. In addition, I give all my patients quite detailed advice regarding what medications to avoid and what herbal medicines to avoid before and after surgery, as these herbal medicines can often thin the blood and give you a longer surgical time, as well as additional swelling and bruising and generally a longer recovery. And so generally speaking, herbal medicines, and specific ones are relevant, are best avoided for 2 weeks before and after surgery in order to give you the best possible results. The other consideration with lower blepharoplasty and the length of time involved is the choice of anesthetic. And generally, local anesthetic, well, it's a difficult area of the face in order to complete under local anesthetic because the lower eyelid is generally quite sensitive, and lower eyelid surgery, being a delicate area, will generally take longer and not be the most comfortable experience under local anesthetic alone. Having said that, general anesthetic, where you're fully unconscious and there is a tube looking after your airway and breathing, well, although your recovery with general anesthetic can be as long as 4 to 6 hours, and so the length of recovery is far longer than the length of surgery. My preference with lower blepharoplasty is sedation anesthesia or twilight anesthesia, and we have refined a sedation technique using multiple sedation medicines that tends to give you a very fast recovery of about 30 minutes before you can go home, but it means that you are super relaxed during the surgery and sleep during the surgery, and this generally means that the surgery can be done relatively faster as you're very relaxed during the surgery. How important is time when considering lower blepharoplasty? Well, if you look at your family members and friends, you will see that everyone's lower eyelids are relatively unique. And with eyelid surgery, it's the best possible result requires tailoring that surgery to your individual needs. And that tailoring does require time. And so time, in my opinion, is not the most important factor when considering lower blepharoplasty. As almost always, anything can be done faster. More important that is consideration is given to the intricate anatomy and your particular facial changes in order to give you the best possible result. Eyelid, and particularly the lower eyelids, is a delicate and intricate part of the face, and it does require attention to detail to avoid factors such as eyelid retraction with the surgical technique. So in addition to the length of time of the surgery, the surgical technique is also highly relevant. So in summary, we've talked about the average length of time for lower eyelid surgery, which tends to be an hour to hour and a half. We've talked about additional procedures that may be utilized in order to give you the best possible result. We've also talked about other factors such as a revision surgery and your general health that may influence the length of surgery. And we've talked about the important factors considering time. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.